Have you ever wondered if your constant fatigue could be a sign of hypothyroidism, or if your unexpected weight loss is the result of hyperthyroidism? These conditions may seem similar, but it's crucial to understand the differences between them in order to take care of your health. In this video, we'll answer crucial questions that many of you may have. How can I tell if my symptoms are from hypothyroidism or hyperthyroidism? What specific signs should I look out for that can help me identify the right condition? What actually happens in my body when one of these conditions is present? If you're confused about what might be going on with your thyroid, stay with me, and let's clear up these doubts. We're going to divide this video into 3 parts: what it is, tests, and treatments. 1. What is it? Hypothyroidism is a medical condition characterized by insufficient production of hormones by the thyroid gland, located in the front of the neck. These hormones, mainly thyroxine, T4, and triiodothyronine, T3, play a fundamental role in controlling the body's metabolism, influencing everything from energy production to body temperature regulation. When the levels of these hormones are below normal, the body's metabolism slows down, resulting in a series of symptoms. Hashimoto's disease is the most common cause of hypothyroidism. In this autoimmune condition, the immune system attacks the thyroid, leading to its inflammation and reduced hormone production. In addition to Hashimoto's disease, other causes of hypothyroidism include iodine deficiency. Iodine is an essential mineral for the production of thyroid hormones, and a lack of it in the diet can lead to hypothyroidism. Radiation treatments. Radiation used in cancer treatment can damage the thyroid. Thyroid surgery. Partial or total removal of the thyroid can result in hypothyroidism. Medications. Some medications, such as lithium and amiodarone, can interfere with hormone production. The symptoms of hypothyroidism can be varied and often develop slowly, which can make diagnosis difficult. The most common include fatigue and weakness, a constant feeling of tiredness that doesn't improve with rest. Unexplained weight gain. Even with a balanced diet, weight gain can occur due to slow metabolism. Sensitivity to cold, a constant feeling of cold, even in warm environments. Constipation. Slow metabolism can affect digestion, resulting in constipation. Dry skin and thin hair. Changes to the skin and hair are common, with the skin becoming rough and the hair thinner and more brittle. Depression and mood swings. There can be a connection between hormone levels and mental health, leading to feelings of sadness or apathy. If left untreated, hypothyroidism can cause serious complications such as heart disease, fertility problems, and, in extreme cases, a condition called myxedema, which is a severe form of hypothyroidism that can be fatal. In contrast, hyperthyroidism is a condition in which the thyroid gland overproduces hormones, leading to an increase in the body's metabolic rate. When T3 and T4 levels are high, this can cause a series of physical and emotional changes. Graves' disease is the most common cause of hyperthyroidism, also an autoimmune condition in which the body produces antibodies that stimulate the thyroid to produce more hormones than necessary. Other causes include overactive thyroid nodules, small tumors in the thyroid that can secrete excess hormones. Thyroiditis, inflammation of the thyroid that can result in excessive release of hormones. Excessive iodine consumption. Excess iodine, from food or medication, can lead to increased hormone production. The symptoms of hyperthyroidism usually manifest themselves more intensely and can include unexplained weight loss. Even with a normal or increased appetite, weight loss can be rapid and significant. Increased heart rate, palpitations, or a feeling of a racing heart are common. Nervousness and anxiety. High hormone levels can cause irritability and anxiety. Excessive sweating and heat intolerance. A constant sensation of heat and sweating are typical symptoms. Insomnia. Difficulty sleeping due to increased energy and restlessness. Menstrual changes. Women may notice changes in their menstrual cycle. If left untreated, hyperthyroidism can lead to serious complications such as heart problems, osteoporosis, and, in extreme cases, a condition called thyroid crisis, which is a medical emergency. Accurate diagnosis of hypothyroidism and hyperthyroidism is crucial for proper treatment of both conditions. The process usually begins with a medical consultation, where the health professional will assess the symptoms presented and the patient's medical history. After this initial assessment, laboratory tests are carried out to confirm the diagnosis. Before continuing, if you're learning about the thyroid and want to delve even deeper into your health, check out the video description for my exclusive ebook with valuable information and practical tips to better understand your thyroid health. Also, subscribe to the channel, turn on notifications, and join our community to find out more. Zweite tests. The most common tests to diagnose thyroid problems include TSH, thyroid-stimulating hormone. This is usually the first test requested. TSH is produced by the pituitary gland and works by stimulating the thyroid to produce the hormones T3 and T4. High TSH levels indicate hypothyroidism, while low levels suggest hyperthyroidism. Free T4, free thyroxine. This test measures the amount of T4 that is available in the blood. In hypothyroidism, T4 levels are usually low, while in hyperthyroidism, they are high. Free T3, free triiodothyronine. Although T3 is usually measured when hyperthyroidism is suspected, it can also be useful in cases of hypothyroidism. High T3 levels are common in hyperthyroidism, especially when T4 is normal. Antithyroid antibodies. In cases of suspected autoimmune hypothyroidism, such as in Hashimoto's disease, tests for antibodies such as antimicrosomal antibody, TPO, or antithyroglobulin antibody can be carried out. The presence of these antibodies confirms the diagnosis of an autoimmune condition affecting the thyroid. In addition to laboratory tests, doctors also assess the symptoms reported by patients. This can include questions about family history of thyroid disease, changes in weight, energy levels, mood swings, and other physical symptoms. A careful assessment can help determine whether the symptoms are really caused by thyroid dysfunction. In some cases, imaging tests, such as ultrasounds, may be ordered to visualize the structure of the thyroid. This is especially useful for identifying thyroid nodules or signs of inflammation. Other tests, such as thyroid scintigraphy, can be carried out to assess the activity of the gland. Early diagnosis is fundamental for the effective treatment of both conditions. Inadequate or delayed treatment can lead to significant complications, such as heart disease, infertility, or emotional problems. It is therefore vital that anyone experiencing thyroid-related symptoms consults a doctor for a proper assessment. Third treatment. Treatment of hypothyroidism and hyperthyroidism is essential to restore hormonal balance and prevent health complications. Although the treatment approaches are different for each condition, both aim to relieve symptoms and normalize hormone levels. The main treatment for hypothyroidism involves hormone replacement with drugs that provide synthesized thyroid hormones. The main aspects of treatment include levothyroxine. The most common medication used to treat hypothyroidism is levothyroxine, a synthetic form of the hormone T4. This medication is usually taken daily in tablet form. The dose is individualized based on the patient's TSH levels and symptoms. Regular monitoring. After starting treatment, it is crucial to carry out regular TSH tests to ensure that hormone levels are within the appropriate range. The doctor can adjust the dose of levothyroxine as necessary. Lifestyle changes. In addition to medication, some lifestyle changes, such as a balanced diet, regular exercise, and stress management, can help improve the patient's quality of life and general health. The treatment of hyperthyroidism aims to reduce the excessive production of thyroid hormones and may include the following approaches. Antithyroid drugs. Drugs such as methimazole, tapazole, or propylthiouracil, PTU, are often prescribed to inhibit the production of hormones by the thyroid. These drugs can help normalize hormone levels, but can take several weeks to show significant results. Radioactive iodine. Treatment with radioactive iodine is a common option for people with hyperthyroidism. Radioactive iodine is absorbed by the thyroid, where it destroys the cells that produce hormones. This treatment can lead to hypothyroidism in some cases, requiring the use of levothyroxine in the future. Surgery. In severe cases, or when other treatment options are not effective, surgery may be necessary. Thyroidectomy, which involves the partial or total removal of the thyroid gland, may be recommended. After surgery, many patients will also need hormone replacement. Symptomatic treatment. In addition to addressing the underlying cause, medications can be used to relieve symptoms, such as beta blockers to control high heart rate and anxiety. Treatment for hypothyroidism and hyperthyroidism is generally effective and can lead to a significant improvement in patients' quality of life. However, it is important that treatment is supervised by a qualified healthcare professional who can monitor the condition and adjust treatment as necessary. That's it. In this video, we explore the differences between hypothyroidism and hyperthyroidism, two conditions that affect the production of thyroid hormones and can have a significant impact on health. Understanding these differences is fundamental so that you can identify symptoms and seek appropriate help. If you are in doubt or suspect thyroid problems, don't hesitate to consult a health professional. Taking care of your thyroid health is essential for your overall well-being. What about you? Have you been diagnosed with any of these conditions, or are you still researching them? Tell us your story in the comments, and let's share experiences. If you think this content has helped you in any way, subscribe to the channel, like the video, and share it with a friend who needs to know. Thanks for watching.